laws, but they are also setting on the ground and trying to implement on the ground the successful healthcare new system. And now we are celebrating on the ground what we had implemented. And now we are watching a documentary about the implementing the healthcare system in the cities and governorates of Egypt as the dream started to come true.
الستر والصحة دي أول أمنية هتسمعها من أي مصري لما تسأله نفسك في إيه؟ علشان كده الهيئة العامة للرعاية الصحية ومن خلال مستشفيات التأمين الصحي الشامل بتتحرك مع شمس كل يوم، هدفها توصل كل بيت وتطمن كل قلب. آلاء إبراهيم بنت جميلة من جميلات الإسماعيلية، عروسة بتجهز لفرحها، لكن للأسف حلمها ما كملش.
بدأت القصة من سنتين، رجعت دم وكده، فبعدها رحت المستشفى في الإسماعيلية.
راح دكتور في الإسماعيلية وعمل تحليل إشعاعات، فقال لا دي عندها تليف من الدرجة الرابعة ومحتاجة زراعة كبد.
ومع تحدي المرض كان في تحدي تاني، إن حد يتبرع على آلاء بفص من الكبد علشان تخف.
مفيش غير انا وهي اللي فاصله واحده، وكنت طبعا مريض غده درقيه. هسيب اختي ازاي؟ يعني هسيبها ازاي؟ كل حاجه هتتعوض بس اختي مش هتتعوض. هي نسيبها كده خلاص. لا، ربنا خلق الطفل.
ولأن الجدعنة بتجري في دم بنات البلد، أختها ما تأخرتش عليها. مصر كمان ما تأخرتش بدكاترتها ومستشفياتها في الإسماعيلية.
تم تحضير الحالة بالفعل، وأقصد هنا بالحالة المريضة والمتبرعة على السواء، والاطمئنان على حالتهم العامة وإن هم جاهزين لإجراء العملية.
تخيلي معايا إنك تروحي الوحدة الصحية اللي جنبك عشان تطعمي ابنك وتعملي له فحوصات ما بعد الولادة، وتكتشفي إنه عنده مشكلة في السمع ومش هيعيش حياته زي بقية الأطفال.
السماعات ما نفعتش معاهم، ورفايدة عشان كانت اول واحده بصراحه انا ما كنتش مصدقه.
كانت صدمه للعيله كلها يعني. الدكتور وجهنا ان احنا نمشي في اجراءات زراعه القوقعه.
احنا هنا في مستشفى الكرنك الدولي بنستقبل حالات زراعه القوقعه، نبتدي نعمل له مقياس السمع بالكمبيوتر الاي بي ار. لو كده نبتدي بقى في اجراءات عمليه زراعه القوقعه.
زراعه القوقعه بتسهل على الطفل ان هو يدرك الاصوات اللي حواليه، لكن عشان نحول الاصوات دي لكلمات او لغه محتاج تدريب تخاطب.
فين قطة؟ أي صح. فين كلب؟ صح. كلب. تاني.
من الأقصر لبورسعيد نشوف حكاية شاب عنده 20 سنة لسه في الجامعة، ولقى نفسه مش عارف ياكل ولا يشرب نتيجة مرض نادر بيجي للواحد في الألف، وعلاجه صعب ومكلف.
المشكلة ابتدت بصعوبة في البلع، بس كل سنة بتبقى أصعب من اللي قبليها. عرفت إن الدكتور أحمد مدكور بيعمل العملية ديت وبيجي هنا بورسعيد. ما كنت متخيل إن الموضوع هيوصل مثلا اللي أنا هطول في الليستة دي. اتصلوا بيا بعد تقريبا أول أسبوعين، قالوا لي هتتحجز في المستشفى عشان تعمل خلاص العملية.
هيئة الرعاية الصحية هي المكان الوحيد حاليا في المنظومة الصحية المصرية اللي موجود فيه مناظير الفراغ الثالث ضمن حزمة الخدمات. هو ده دايما الحلم اللي بيحلمه أي طبيب، إن يكون قادر يكون شغال في مكان مجهز بأحدث التجهيزات العالمية، ويكون قادر ياخد القرار الطبي الصحيح للمريض.
حقيقي يا مصر دايما ولادة دكاترة وجراحين عظماء، وتحت مظلة التأمين الصحي الشامل على إيد جراح مصري عبقري اسمه الدكتور أحمد مدكور. اتعمل العملية هي الأولى من نوعها، اتكلمت عنها المجلات العلمية والعالمية وسموها باسمه مدكور تكنيك، يعني تقنية مدكور.
التقنيات دي هي التقنيات الأحدث في العالم. قدرنا ننشر بحث في جريدة الجمعية الأوروبية في تطوير طريقة علاج مرض الأكاليزيا بتقنية البوين، تقدر تساعدنا اللي احنا نعالج الحالات المستعصية.
في قلب صحراء جنوب سيناء حست الحاجة صبحية بدوخة شديدة، راحوا بيها على المستشفى جري، مستشفى شرم الشيخ الدولي.
ازيك يا حاجة؟ عاملة ايه؟ ألف سلامة ليك. تقومي بالسلامة إن شاء الله.
أول ما تحت الفرح
قدام العصر كذا ونطيح هنا قمر ونفضل المي ولاني بعد من حاجه رصيد تقول ويحيي كذا
دي من الحالات المتكرره في كبار السن بصفه عامه، نوبه اغماء جت على المستشفى هنا، عملت رسم قلب تبين ان في انقطاع تام في الضفيره الكهربيه،
وفورا قاموا دكاترتنا بعمل اللازم وتركيب جهاز تنظيم ضربات قلب، وكل ده تحت مظلة التأمين الصحي الشامل. تخيل معايا انك تتعب لا قدر الله ويتقال لك الخبر ده العملية عايزة 1,000,000 جنيه. طب تخيل بقى يتقال لك هتدفع فيها 400 جنيه بس. هو ده بالظبط اللي حصل مع الحاجة فتحية من جنوب سيناء.
قال لي عندك القلب، زهقت بقى في نفسك كده، العب بتاعي زاد زرقيت وزيت، ما كنتش بقدر اخش الحمام خالص.
الحمد لله تم مؤخرا إضافة زرع الصمام الأورطي عن طريق القسطرة بديلا عن الجراحة، وبالفعل تم عمل أول حالة في جنوب سيناء سنها 73 سنة.
كويسين ومحترمين وعملوا له عناية، يعني قاموا بيا يعني عملوا له كل حاجة، لا دفعت جنيه ولا دفعت 10 ولا حاجة خالص.
وفي شرم الشيخ الخدمات مش بس للمصريين، لا كمان ضيوف المصريين. الخواجة باولو سايح إيطالي لمصر يتفسح ويتبسط، وفجأة الحق الخواجة باولو تعبان، الحق الخواجة باولو قلبه توقف.
Vengo dall'Italia, dalla provincia di Firenze. Sono arrivato 2 giorni fa. Appena sono sbarcato dall'aereo mi sono sentito male e ho perso conoscenza.
كانت حالة تحدي شوية لأن هو جالنا بتوقف عضلة القلب، والمسعف على الفور بدأ معاه انعاش قلبي رئوي، كان راجع بعلامات حيوية غير مستقرة. على الفور تم نقل المريض إلى وحدة العناية المركزة ووضعه على جهاز تنفس صناعي ووضعه على أدوية مدعمة للدورة الدموية.
الموضوع ما كانش صعب عادي، واحتاج تدخل عاجل تقدم له من خلال برنامج نرعاك في مصر. دلوقتي باولو خف ورجع بلده بألف سلامة.
Mi ricordo che il personale medico è stato molto gentile nei confronti, si sono dati parecchio da fare.
Grazie. وفي محافظة الإسماعيلية رجعت الفرحة تاني لآلاء وأسرتها بنجاح أول عملية زراعة كبد في منظومة التأمين الصحي الشامل.
هي مش سهله بس ربنا بيهونها والله، وبتعدي على خير فعلا، وكل ده بيتنسي في الاخر مجرد ما بتشوف الشخص اللي عايزاه يبقى كويس. لا بقينا خلاص، انا نفسي عايزه احضر الفستان عشان خاطر فرحها يعني.
الحلم البعيد اتحقق. رفيدة وآمن عملوا العملية في الأسرة ورجعت الفرحة لكل بيوتهم.
احنا بنقول الحمد لله ان كان في التأمين الشامل دلوقتي اللي وفر لنا العملية مجانا. بصراحة وفر علينا حاجات كتير احنا ما كناش كأهالي نقدر نعملها لأولادنا يعني.
برضه ما كنتش مصدقة يعني كل اللي حصل ده، برضه يعني أنا مش مستوعبة. أول مرة كانت نازلة على السلم وأبوها نادى عليها فبصت وراها.
فايدة. الحمد لله على السلامة يا خالد. احنا كنا عملنا عملية البوين مطمنين عليك.
البلع تمام، زدت تقريبا 10 كيلو.
كويس، انت طلعت الوزن المثالي بقى.
وفي شرم الشيخ الحاجة سمية دلوقتي رجعت تاني، نورت بيتها وسط عيالها وأحفادها. ربنا يديها ويديكوا الصحة.
والله عمل جميل معنا،
ومش قادرين على شكركم والله. شكركم مش كفاية والله. نشكر الرئيس عبد الفتاح السيسي اللي عمل مجهوده مع جنوب سيناء وشمال سيناء، بالذات للغلبان للمسكين.
مبسوطة والله، مبسوطة منكم، يا رب ويرزقكم برزق الحلال.
الصحة رزق، الصحة ستر، الصحة أهم نعمة. النهاردة حكينا لكم كام حكاية من 6 مليون حكاية، وهنكمل محافظة ورا محافظة ورا محافظة لحد ما نحقق الحلم، حلم التأمين الصحي الشامل، حلم إننا نأمن صحة كل المصريين.
And after we watched a sort of the success stories that Egypt had really achieved within the framework of the Egyptian healthcare organization. Let me please allow me to call now to welcome Mr. In the name of God, Your Excellency, Prime Minister Dr. Mustafa Madbouli, Your Excellencies, our esteemed ladies and gentlemen, distinguished guests, please allow me, on behalf of the Healthcare Authority, to welcome you in our annual forum in Cairo, which became an annual platform in implementing the healthcare system, in which we learn and we try to apply and implement all the strategies of the political leadership. Your Excellency, Prime Minister, your attendance today is a great pleasure, which actually reflects the keen-on of the Egyptian state to support all the strategies of the government. And that's why, out of here, we are talking on behalf of the Healthcare Authority that we are authorized to implement the strategy and the vision of the Egyptian state, the framework of the healthcare general system, to implement great breakthrough within the first phase of the healthcare system, and now we are on the new phase, which actually requires new steps and forward steps to secure the Egyptian citizens all the respectable and decent healthcare system with our forums and with our partners internally and internationally. Ladies and gentlemen, distinguished guests, this annual forum now became a platform, and this annual forum this year, the version of this year, will witness new also improving and enhancing the partnership with our partners, also implementing the healthcare system within the Egypt's vision of the Sustainable Development 2030 through enhancing the comprehension meaning of the healthcare system, and this above signing more than 20 memos of understandings with many partners internationally and regionally. And out of this concept, our main aim of the healthcare system in our organizational and individual concept is to try to improve the healthcare system, and we try here now to show you and podcast the first phase of the healthcare system. We started implementing the healthcare system out of 2019 in Portside City. The comprehensive healthcare system started with the city of Portside and ended up with implementing the complete and comprehensive healthcare system in Aswan. And the same year, the Prime Minister had, upon his incentives, he directed to start on the spot with the second phase, parallel with the first phase, with implementing this and enhancing the all the medical centers and all the hospitals. One of the Lancet great international medical magazines started to wrote a reportage about Egypt, how about the implementing the great healthcare system in Egypt, and started to answer great question. Why is Egypt now expanding all such amounts and allocating all such amounts, milliards or billions of pounds on the first phase of the healthcare system? The answer is, of course, is not only for the healthcare system, for the hospitals, but also for the medicines and for the medics. Talking about the healthcare system, the comprehensive healthcare system, for the first time Egypt tried to governance the healthcare system to separate providing the service than expanding on this service. So that Egypt started first to invest in the infrastructure geographically in all the Egyptian governorates, and all are belonging to the healthcare authority. And now, of course, the patient or the citizen can go to any health center in his country or countryside without paying any penny. And now the healthcare authority tried to reset the pyramid of the healthcare system in all the governorates, in the countrysides, in all hospitals and the medical centers. Out of the point, adopting the concept of the health care for the family. On the organizational level, also we tried to enhance we started not only with the infrastructure, but we improved the appliances and the operating systems, also the financial systems within such organizations. And within the frame of the healthcare system, in the first phase, 75% of such hospitals are now belonging to the international standards with the GCI, the American organization of the GCI. And Egypt started and could successfully out of the healthcare authority. Now we have a medical file for each citizen now, containing all the complete data about the patient, within the coordination also with the armed forces and the Ministry of Health. We started here also to unify the protocol of care. We tried to unify first around 50 protocols of care, improved the accommodation, also all the appliances, all the furnishing the hospitals, beds, 17% around, and we are going to 15%. Also, we try to also to operate so many surgeries, and started from day one, we tried to operate and work in an economic way. And that required not only that we require or consider only the economical side, but as we expanded 1.5 billion within the first phase and around $7 million, and talking about the training and the healthcare system, not only talking about financially, but we're talking about improving and enhancing the environment, the internal environment, to start it to be a hub for the medicines and for the nurses, and that reflected on the satisfaction of all the patients. And this is the factor that we are working on, started to satisfy also the workers of the medical healthcare system, which approached 91%. We tried to decentralize providing the care and the medications. We tried to work on getting rid of the poverty first, and to reduce the expenses on the healthcare system. When we approached to less than 47%, and that was before around 65%. And within our framework of the healthcare system, of course, we're trying to get to know the satisfaction of the percentage of satisfaction of the patients against the services, the medical services that you are getting. The journey was so long, it was a tough and hard journey, but we got many outcomes, many lessons out of this journey. Out of one of the challenges that we got, how to rationalize the expenses and to keep in the same time the same level of providing a good and decent service. Also through signing protocols and contracts with many pharmacies and pharmaceutical companies that we implemented, as you see, within our first phase in Ismailia Governorate. In short, the project, the mega project of the healthcare system, it's a mega project of the state of Egypt, to implement a great vision of the political leadership of President Abdel Fattah el-Sisi, to implement and to turn the dream into reality. What we are watching and witnessing today is an outcome of the rational and wise vision of the President, of His Excellency President Abdel Fattah el-Sisi. And now I'm thanking out of here all the Dr. Khaled Abdel Ghaffar, the Deputy Prime Minister, Minister of Health and Population, for all his efforts, and all the eligible ministers and ministries as well. And our thanks expanded from our Egypt Healthcare Authority as well, and for the healthcare system to remain a reality now, an eligible result and reality for each citizen, and peace be upon all of you. Many thanks, Dr. Ahmed Sobki. Thank you for your showcase. And cause the country, the state, to be built with the great efforts of its citizens. Now, with the song of great Azama, Al-Azama, with the singer Hussein Jasmine.
اتاخدت واتحركنا بسكة حلمنا، ما هو ايد مع ايد بتسهل دايما تسند في البنا. بسم الله وبان اولنا وان شاء الله عقبال الباقي، بالروح دي لو كملنا على قد ما نتعب هنلاقي. الخطوة اتاخدت واتحركنا بسكة حلمنا، ما هو ايد مع ايد بتسهل دايما تسند في البنا. بسم الله وبان اولنا وان شاء الله عقبال الباقي، بالروح دي لو كملنا على قد ما نتعب هنلاقي. لما بنتجمع على حاجة بنقدر نعملها، بنشيل الشيلة هلا بلا وبنتحملها. جوانا عزيمة جوانا عزيمة، ودي حاجة عظيمة تشهد ليها الدنيا بحالها. الله الله يا بلدي عظمة على عظمة، كملها يا ابن بلدي عظمة على عظمة. الله الله يا بلدي عظمة على عظمة، كملها يا ابن بلدي عظمة على عظمة. البركة في ناس عمالة بتتعب لك يا بلادي، كله بينجز في الوقت بجد محدش هادي. كلمة وقلناها وهو نفذناها، أيوة بنتباهى وشايفينك قد الدنيا دي. الله الله يا بلدي عظمة على عظمة، كملها يا ابن بلدي عظمة على عظمة. الله الله يا بلدي عظمة على عظمة، كملها يا ابن بلدي عظمة على عظمة. عظمة على عظمة، فرحانة يا مصر ودايما اسمك قد الدنيا. ماشيين في طريقنا الصح خطوة تجيب التانية. ملايين حواليكي ماسكين في ايديكي، حالفين نبنيكي وحالفين مش هنضيع ثانية. الله الله يا بلدي عظمة على عظمة، كملها يا ابن بلدي عظمة على عظمة. الله الله يا بلدي عظمة على عظمة، كملها يا ابن بلدي عظمة على عظمة. عظمة على عظمة، الله الله يا بلدي عظمة على عظمة، كملها يا.
اسمحوا لي الآن
Allow me, please, to invite His Excellency Prime Minister Dr. Mustafa Madbouli, because we are now with the time to start to offer the prizes to many eligible partners. Great prize of the best hospital goes to the hospital of Ismailia, receives Dr. Khalid on behalf of the hospital. And this for acquiring the health center, the GCI, the ISO 50 and 51 for labor implementation. Also the first prize for the Hakim Busaliya of Aswan. Dr. Mahmoud Baghdadi receives the prize for acquiring the best ever satisfaction rates, and the clinical best prize for the medical complex of Nasr, the specialized Nasr Hospital in Ismailia, received Dr. Ahmed Matkour and Dr. Ahmed Bastawisi for the roles on contributions of implementing operations and surgeries. And now it's the great prize for the great mom, the greatest mom, the mom, Mrs. Fatma Muhdisuki Muhammad, the mom of the pharmacist Jihad Muhammad in Port Said. Congratulations and congrats for all the And now I'm inviting His Excellency Dr. Mustafa Madbouli, Prime Minister of Egypt. In the name of God, ministries, distinguished guests, it's a great honor participating with you today and celebrating 6 years of success after implementing and improving the health care system like today was like the day 6 years ago. This organization, it reflects the vision and strategy of the state in the vital sector of the healthcare. The healthcare system is supposed to be the best ever and the most important sector which acquires the satisfaction of all the citizens upon receiving decent and humanitarian health care service, supposed to be one of the main pillars of our Vision 2030 and our vision for building and investing in the Egyptian citizen. What we've been working on years ago, in particular within the healthcare organization, to re-governance the healthcare system through improving the infrastructure of the healthcare system in Egypt and continued rollout of the universal health insurance system, which is supposed to be the main cornerstone for the healthcare system in Egypt. Within the framework of
يتواكب مع أفضل النظم الصحية العالمية. عن البنية التحتية الصحية
strategy, and in recent years we started to note many improvements and that nobody can disregard. I believe you all witnessed great improvements in our hospitals and in the healthcare, the infrastructure of the healthcare organization. Now we're talking about the many governorates and many cities in the countryside. I tried, as I visited such hospitals, what I always heard while visiting such hospitals, the patients try, what I always hear before, as we try to make an X-ray or to diagnose a disease or something, we must go to Cairo, never to stay here home on the countryside. But now you witnessed great improvements in the hospitals and in the infrastructure of the hospitals in the countryside. And that's why the government had concentrated and focused to improve the healthcare system in general, and to establish more than 1,400 healthcare centers in 24 governorates, in addition to 1,220 other projects. And all this contributed to accelerate the and to elevate the healthcare system. And this was with the many international organizations had assured our progress and improving more than 250, and that was also how Egypt acquired the golden license for ending virus C, and to be empty of virus C, to be empty of, to get rid of malaria, and also the international accreditation of the many other diseases. That all reflects the great philosophy of caring and treating this file. Ladies and gentlemen, Egypt had succeeded to achieve great success for the first phase of the healthcare system through providing many services and across and according to the global standards. Such hospitals, we tried to improve the equipment of such hospitals with the latest medical equipments. And of course, because when we talk about the healthcare organization, the organization itself had witnessed great improvements within the last years. And as we heard in the first video, we tried to implement the cochlear implementation, the audiogram hearing test, and the many surgeries. And this all implemented and reflects the success of the healthcare system. And that's why Egypt had great importance and cared about the poor people who cannot approve and who cannot afford the medical service, with the percentage of 17.7%, and which also reflects the responsibility that the healthcare system. And now we are about to start with the second phase with Matruh, Damietta, and Sina, with the investments of 15 billion pounds to cover more than 18 million patients or person for the second phase. And that all improves that Egypt never hesitated to provide the great service and the decent service to its citizens, for all the participation with our partners from the state sector and the private sector. Also, many thanks to all our partners, and I'm looking forward for suitable recommendations at the end to improve the healthcare and the sustainable healthcare system in Egypt. Many thanks for you. Thank you all for listening. Many thanks, Your Excellency, Prime Minister Dr. Mustafa Madbouli, for your important words, which actually acquires and assures, reiterated the importance of the Egyptian citizen and how he comes as a priority on the agenda of our sustainable development agenda. And now thank you all for attending today, and we're gonna be, of course, we meet afterwards within for implementing the second phase. And we still have the event of today, we will acquire many prizes, so that's why we're asking you to keep sitting, please, because we're still having many. Well, ladies and gentlemen, that was the launches of the 6th annual forum in Cairo, and taking place today and for tomorrow on the 26th and 27th of November, under the patronage of His Excellency Prime Minister Dr. Mustafa Madbouli, and under the theme of this year of From Division to Expansion, Elevating Healthcare to Global Standards. Well, we witnessed as His Excellency Prime Minister Dr. Mustafa Madbouli addressed the annual forum of the healthcare, mentioning the importance of the Egyptian citizen and the efforts, the exerted efforts from the Egyptian government with its partners internally and globally to end and finalize the suffer of the Egyptian patients and to improve the infrastructure of the healthcare system, and of course as he reviewed as well the improvements and the infrastructure and of the healthcare organization in general.